Hello, this is Dr. Avery Strait with the Cattle Health Center, and I'm here to give you an overview of the Cattle Health Cooperative Agreement instructions and trainings today. Today I will be covering the Cattle Health Goals and Objectives sections within the Grants and Agreement Guide, go over the guidelines and give an update to our reporting requirements using the DIS platform. And also, please note that the animal disease traceability activities are covered in a separate presentation and section of the guide. The cattle health surveillance and outreach goals have not changed greatly since last fiscal year. It's important to conduct surveillance in domestic cattle and bison and targeted high-risk wildlife populations to maintain national, state, and herd disease status certifications, as described in the program regulations, program standards, and surveillance plans. Also important to respond to identified outbreaks in cattle and bison in a timely manner, and outreach efforts should be conducted to complement the program activities. Now we will go into specific program goals, starting off with brucellosis. For non-Greater Yellowstone area states, so those states other than Montana, Wyoming, and Idaho, we still need to provide education to state, tribal, and federal VMOs, AHTs, AICs, and any other appropriate animal health officials. We still like to highly encourage abortion screening in cattle and support the brucellosis epidemiologic investigations as necessary. The states of Idaho, Montana, and Wyoming have separate state objectives for the brucellosis program. Surveillance activities are required in these states by brucellosis management plans, and these states must implement risk-based management plans to mitigate the risk associated with wildlife reservoirs. These states must hold at least one meeting between state livestock officials and wildlife officials. Abortion screening in cattle is encouraged, and these states must also conduct epidemiologic investigation and other program activities as appropriate. And again, education must be provided to state, tribal, and federal VMOs, AHTs, AICs, and any other appropriate animal health officials. The BSE goals and objectives for all states include collecting samples to achieve state-level goals defined in the BSE National Sampling Plan. Collection should represent the clinical suspects over 12 months of age, emergency slaughter, so non-ambulatory over 30 months, and fallen stock dead over 30 months. There must be outreach conducted and education with accredited veterinarians and producers to encourage sample submissions in support of the national surveillance goals and sample collection targets. Also must conduct outreach and education with public health officials and public health laboratory directors about forwarding rabies negative submissions from cattle to MVSL for BSE surveillance. The cattle fever tick objectives for Texas include conducting targeted surveillance outside the permanent quarantine zone, coordinating wildlife hunting surveillance with local, state, and federal entities, both within and along the permanent quarantine zone, providing fever tick program data, including tick submissions, program data, and surveillance disease testing, to collaborate with Texas Parks and Wildlife on white-tailed deer census and fever tick surveillance, and to collaborate with APHIS Cattle Fever Tick Eradication Program and the Agricultural Research Service on joint fever tick research. Next, we will move on to the tuberculosis objectives. For all states, this includes visiting state-inspected slaughter establishments to validate slaughter inspection, conducting outreach training and education with accredited veterinarians to ensure compliance with existing performance standards, implementing a system to monitor the caudal fold test response rates, conducting epidemiologic investigations as appropriate, providing travel funds to cover the travel costs for state VMOs comparative cervical test training, and then for states with a bovine tuberculosis detection, The objectives include conducting targeted surveillance in geographic areas where TB has been identified, implementing herd plans and management strategies, implementing a statewide risk-based management plan, and conducting wildlife surveillance to determine if TB is present in wildlife. Objectives for the blood and tissue collection program include assisting VS in bringing slaughter plants and all rendering plants into compliance with the blood tissue collection rule or in conducting quarterly inspections. For the preparedness and response objectives, states should prepare, maintain, and exercise state-level plans, investigate, control, and eliminate emerging, endemic, zoonotic, and foreign animal diseases, and implement risk-based management plans to mitigate risk. The reporting and data entry requirements for cattle health cooperative agreements includes completing applicable monthly NLRAD NARS reports, completing data entry in our databases to include EMERS, SES, MIMS, etc. for test records, vaccination records, investigation documentation, to supply surveillance and outreach data to the AVIC for those program activities that the area office does not have the availability of on a quarterly basis. And those cattle health quarterly reports will be conducted in the DIS platform. And the annual reports for Brucellosis and TB will also be collected on the DIS platform. Data submitted through surveillance and activity reports may be used to inform decisions about future agreement funding levels. These reporting and data entry objectives are slightly newer in that we're using the DIS platform moving forward for the annual reports. On this slide, you can see the quarterly reports. On the DIS platform, there's job aids. Those are available and can be found on the DIS platform when you go to enter those quarterly reports. The TB and Brucellosis annual reports are also on the DIS platform, as I mentioned. There's a TB annual report user guide and a Brucellosis annual report user guide that is posted on the DIS platform. When you go to enter those reports, there should be a link on that page that will guide you to those documents. And then we are conducting training webinars for the completion of these reports in the upcoming months. And as always, you can reach out to the cattle health staff if you have questions. This concludes the Cattle Health Cooperative Agreement training. If you have any questions or comments, you can email them to the address you see above there to reach myself, or you can direct your emails to your AVIC. Thank you everybody for joining us today, and we appreciate your time.